Many Hispanic and Black people say they are skeptical about COVID-19 vaccine. Public health experts are worried that some of the people who are skeptical of a coronavirus vaccine are among those who may need it the most. That includes Latinos and African Americans, who make up a disproportionate number of people severely affected by COVID-19. Welcome to Health Talks. I'm Laura Termini, and my guest today is Dr. Olvin Carrasquillo, Chief of the Division of General Internal Medicine at the University of Miami Health System. Dr. Carrasquillo is also a national expert in minority health and health disparities, community-based participatory research, access to care, and community health workers interventions. So welcome. Hi, doctor. Thank you so much for your time.
Thank you, Laura, and thank you so much for having me. And thank you to all the listeners. Again, talking about a topic that's critically important to our community right now.
It is. I have so many questions, and I ask also our audience and friends to ask questions. So at the end of the interview, I'm going to ask you some of those. We have so much information about the vaccine. So most of the common questions are, does receiving the vaccine prevents people from spreading COVID-19?
Yeah, and I think it's one of the more common things. And again, right now, we're still struggling with vaccine availability and getting everyone to get the vaccine. We think those problems eventually will be resolved. Just a little bit more patience with us for right now. But right now, if you get the vaccine, we're still telling everybody, we still need to follow all the other things, the social distancing, the mask wearing, and everything else. We're not at a point where you've gotten enough of the population vaccinated where we can relax that. So yes, you can still, the probability of spreading it is much, much lower after you got the vaccine, but it is still possible. The vaccine studies were really designed to prevent you from getting what we call moderate or severe COVID. The complications that we as doctors are really afraid of, like landing in a hospital, being on oxygen, being on a ventilator. Those are the things that we're really scared of. But there is still a small risk of being able to spread the virus and being asymptomatic. So that is why, one thing, please follow all these precautions. We still need patience for at least, a few more months. People want to know when, but we still need to do that. And obviously everyone needs to get the vaccine so we achieve enough of the vaccinated population so that then we can relax these other measures.
What do you think, Dr. Latinos, we are particularly skeptical about the vaccine?
Mm-hmm. Well, first of all, there's a couple of things. Even the Latinos that want the vaccine right now, it's hard to get it, right? I get a lot of emails from my patients. Obviously, we're limiting the vaccine right now to people like healthcare workers, the elderly, and even then for Latinos, you have to go online, make an appointment, and all those IT savviness are a challenge right now. So it's important that we address those logistical issues. The manufacturers are ratcheting up supplies, and the federal government and even the state government are now being much more serious about vaccine distribution. I've seen some positive stuff. So again, we think we'll have those problems solved soon, but there's also a lot of misinformation and miscommunication. And that's the part that really concerns me as a Latino, because I've heard a lot of stuff. We've been doing a lot of focus groups, a lot of listening, a lot of community forums. Some of it is legitimate questions. And there's also a lot of stuff that's just based on conspiracy theories that really bothers me.
Yes, I experienced that in my household because at the beginning when we started telling people in Chicanola about the vaccine, and I was very excited about it, and I told my mom and my dad. So my mom was very, happy. Oh yes, I'm gonna get it. She's of course 65 plus. And then all of a sudden last week, she told me I'm not getting the vaccine. And I go, why? I've been fighting the system for a month, trying to get an appointment for them. My dad is in long-term care, so at home. So it's very difficult for me to even take him to a facility. So I have to wait until something is available. I can take my mom to you if you get the vaccine. But then my mom got oh no, because fulanita and fulanita, called me and she said that she didn't give any vaccine to her kids because when they were little, the vaccines and the virus. And I go Mom, stop it. You cannot hear rumors, and don't ask your friends about it. And I told her about this interview.
Yeah. It's really interesting, the disinformation campaigns and people, there's all sorts of conspiracies about the conspiracies, who's spreading these and why. I can tell you that this stuff is really well done. It's really professional. I mean, it looks like somebody's really targeting our community purposely. And it scares me to find out where's that coming from, who's doing this, and why is there so much effort to scare Latinos away from the vaccine. But it's incredible how well and sophisticated these groups are that are spreading this stuff. And I've heard all kinds of stuff. And it's really amazing how you can get somebody to think that their cousin's friend's Twitter posting is much more credible than doctors and nurses and medical professionals. But that's where we are right now, where these people really, they don't trust the government, they don't trust the health authorities, and they don't trust their doctors and nurses. They'd rather trust what somebody who God knows who that person is posted on Facebook. So it's something we're fighting, but I can tell you some of these are very good at spreading a lot of this really, really conspiracy stuff out there.
And to me, it was like a black and white, thing. It was, I said to my mom, listen, Mom, you choose. You want to die in a hospital alone, or you want to die at home or whatever with the vaccine if you think the vaccine is going to kill you. And she was like, oh, okay, mija, I'll do whatever you want me to do.
Yeah, I'm glad you changed your mind that way. A lot of what we know about this, to overcoming this stuff, is that it's really hard. Usually if you tell people you're crazy, you don't know what you're talking about, or listen to your doctor, that message doesn't work. You have to talk to them. Why do you believe this is true? Do you think that information you got is from a trusted source? Why do you think your cousin's friend's Facebook posting is a trusted source of information? So it's really hard. And there's a whole science to how you address this misinformation and miscommunication. The problem is we're in the middle of a pandemic and we need to do something now, You can't really go through all the scientific steps on how you do this. We're trying to do some of it. But yeah, a lot of it is individual talking one-on-one and showing people that posting may not be the most credible source of information. So it's scary. Yeah, some of the stuff I hear is very scary about, some of the stuff we all know about the nanobots, this is how the government's going to track us. This is how they want to deport us back to our countries. This is how they're going to make us sterile so we can't have kids. There's a lot of this stuff. The 5G towers I've heard in every group, so that one's not just Latinos. Every group seems to be convinced that somehow this is, Bill Gates and the telecommunications companies, and that there's something. First, it was the 5G towers and the COVID virus, right? So first it was, they would resonate and it was a government virus. Now it's the same thing, but instead of it being the government virus, it's the government vaccine, which is resonating. So it's funny how these people's theories kind of fluidly move from one thing to another without them, wait, how come a few months ago was this and now this month is this? And people buy into all this, so it's very scary. And they listen to each other, right? So they listen to their 10 friends who are all reading the same post, and then these are the 10 people they talk to, and then it goes, everybody knows this, everyone, because that's the little circle, conspiracy circle there. So it's very scary.
Doctor, and here in Miami, can people go to Umiami and ask their doctors if they have the vaccine available, or they have to go through the whole thing that I've been doing for the past month, just waiting for miami-gov.com and the major to give us some light?
And again, on behalf of the federal and state government, I really apologize. It was an extremely poorly done rollout method. It was highly problematic. This whole approach, I'll let the health systems have never been involved in mass vaccination campaigns do this. I mean, that was very poorly thought out. There should have been, we've known about the vaccines for months and months, and there was no plan. So now we have a new federal leadership. Hopefully that'll help. I saw some stuff from the state last week. Now they're actually making registries where you can go sign up and then they'll contact you. So those are things that if you don't have internet access, you can actually call up. So now finally a month later, there's a phone number. Very basic things. And hopefully there'll be people answering those phones, which is a concern. So we at UHealth, we've tried to do the best. We have Jackson who's tried to do the best as well. We're prioritizing elders right now. Yes. And there are lists, they randomly select. We pick the ones with the highest comorbidities, and we've been working those lists. But there's not enough vaccine right now. That's the major problem, not enough vaccine to go around. UHealth moved to a centralized site over by, one of the buildings off site, so it's not here at the main campus anymore. So, we're learning, we're doing those steps, but we really need the federal and state governments to step in. We got good news last week about one of the other vaccines, Janssen, so that'll add a lot more supply. And from what I'm reading, by sometime in April or May, we should have a ton more vaccines and we'll be able to vaccinate the whole country. But right now, it's a little bit of patience. We're going through the priority list. Eventually, everyone will have the chance to be vaccinated, but it'll take us some time. A few more months. We've lived for a year with this. Give us a few more months. We'll get it right.
Doctor, you know that my whole family got sick from COVID, but it was so weird because all of them were sick and only my mom, my dad, and me were not in the same household. It was crazy, but it's still, I'm still worried. I'm worried more about me right now because I was the one not getting it, and my mom and my dad. So I'm like all day checking the websites, trying to sign in my parents everywhere. So because we also have a little niece, and you never know when the kids get COVID or not. She already got it. But we're trying to understand all the info. What are the most common questions that people or patients ask you?
Well, I think you said one. A lot of people ask, I already had COVID, should I get vaccinated?
Okay.
And the answer is that we don't know how protective the antibodies are that COVID makes and how long they last. So we're telling everybody, wait 90 days after your diagnosis, but certainly get vaccinated. So that's one of the questions that people are asking. A lot of people ask me, especially with new vaccines, which is the best vaccine for me? And I say, unfortunately, we're not at a place right now where you go in and they have 5 vaccines and you get, okay, which one do you want? Exactly. The best vaccine for you is the one that you get, all right? Whatever vaccine is offered, certainly get it. Maybe later in the future, you can decide whether you want a different. Right now, please get the vaccine. They're all authorized on emergency use authorization. We have good data on at least 3 vaccines now. One, hopefully the Janssen one from last month will get approved by the end of this month. So whichever one you're offered, that's the one. We can't pick. You can't go and say, hey, it's not like cereal that you decide, okay, I want to buy this one. It's not how it works with these vaccines. So please get vaccinated. Don't worry about it. How long do vaccines last? And I say, well, why don't you get the vaccine now and work on that? We have good data that the antibodies last several months from the vaccines. We hope they last longer. We're following people in these studies for 2 years. So we'll have more information further down the line about this. Yes, I understand right now you want to know what you need to do next year, but what you need to do today is get vaccinated today. All right. Next year, we'll have the answer for you whether you need another. Right now, we don't know. We have good data from the antibodies. It looks like they stay positive for a time, but that's next year, not now.
Let me tell you, I'm into science. If they tell me that, I get the vaccine for you, you're going to be controlled by the government or the aliens. I don't care, doctor. Yeah. Control me. I just want to live my life and not be afraid, because it's been such a tough year for all of us that I want to be able to be, to live again in the present. And if I get the vaccine every year to be protected, let's be it.
Yeah, so it's amazing. People also want to know, one of the really common questions is contraindications to the vaccines. And there's very few, right? I mean, if you have one of the chemicals in the thing, that's different. But in general, people are very concerned about allergies because some of the vaccines initially had major allergies. We're not seeing that much of it in terms of allergic reactions. But if you have severe allergies, we do watch you for 30 minutes. And it's we take a little bit more care just to make sure. So allergies is not a contraindication to the vaccines. The side effects, I mean, the vaccines do have some side effects. It's important. My arm hurt for 2 days after I got it, 80% of the people get arm pain after you get injected. Some people do get a low-grade fever. Some people do get body pain. Some people get fatigue. It usually lasts 1 to 2 days after the vaccine, but it does happen. But, all these major side effects, people saying everyone who gets the vaccine ends up dying or stuff like that. Obviously, that's conspiracy theories. But we do know, yeah, your arm's going to hurt. You may get a little bit of a fever the next day. You may feel tired for a day or two. But again, we're protecting against a pandemic that's killed, for over 400,000 people in this country already, and, a couple of million people in the world. So we do need, would I take my arm hurting me for 2 days to be vaccinated? Absolutely.
Thank you so much, doctor, for all the info. We're going to be sharing all the info on Chicano social media. So thank you so much for your time, doctor.
Thank you.